Yes, my friend, thank you for coming. Thank you for choosing our clinic for this treatment. You come here for Istanbul protocol for the prostatitis treatment, for cleaning your prostate. Our aim was this. You had an issue, an infection, which is not treated in your country.
Yes, that's right.
We can say your country, okay? Any problem?
Yes, no, it's okay.
No, you are coming from Switzerland, and what was this? What was your story? Why it didn't cure? What happened? Can you tell us?
So at first last year I had an infection,
Yeah.
and the pain comes 1 month after. I go back to the doctor and they say...
Did you treat it when you have the infection?
Yes.
Immediately treated?
Yes, immediately, yes. And after,
What did you use? Did they take any culture? First, no, we don't take. If there is a infection, do you think it's a sexually transmitted infection?
it's possible, yes.
Okay, there was a suspicious sexual relation. You had some pain or liquid coming out?
No, just pain and yes, go to the toilet a lot of time.
Yeah, frequent urination and pain in the penis.
Exactly.
So you said, okay, you go to doctor. They said it's an infection. So we routinely give some ciprofloxacin or
Exactly.
cephalosporin.
Some antibiotics, yes.
Antibiotics. We don't give injection. So at the initial exposure, and usually 90% it heals.
Exactly.
But what happens?
So 1 month after, the same symptoms come back.
Come back. So it healed first, then it come back.
Yes, and I took antibiotics for another time, and then it was okay.
It healed again.
Exact, for 1 or 2 months,
Okay.
and after it started with pain in the urethra.
Yeah.
And dysfunction erectile. So nothing.
Okay. You have urethral pain, and immediately in the erection you had some difficulties, right?
Exact, that's right.
Yeah.
And after I had pain in some pressure in the anus.
Okay.
Some pain in the pelvis.
Yeah.
Everything. In
So
not-
you
not
said
in the
something
same
is
time.
going wrong, and you
Yes.
had no idea with chronic prostatitis at that
No,
time.
at that
So
time,
you
no.
begin to search, right?
Exact.
In the internet, you searched, you made some search.
Exact. Because I don't want to say something wrong to the doctor in Switzerland, but it was difficult because at first they speak about the pudendal nerves. After.
Okay, when you have pelvic pain, it starts with the infection. For me, if something starts with infection, it must be infectious.
I know.
If there is no infection and you have pelvic pain, okay, pudendal nerves compression, question mark, it may be.
Yes.
But it is start with the infection, so it must be an infection. So they thought about this.
It's about this. After I made some tests, it was not that.
Yeah.
They speak about pelvic pain.
Yeah,
with
chronic
the
pelvic
muscle.
pain syndrome disease, chronic pelvic pain disease, such things.
Exact.
Uh,
I did a lot of exercise, physiotherapy.
Yeah.
A lot of things.
Really, a lot of you did them, you obey them, and you try to.
Exact. It make me better. That's right, because yes, the muscles
Yeah.
are strong, but the things in the pee continue. I say okay, it's not possible.
Was it pain in the?
Not
urethra?
pain, but
Discomfort.
discomfort. Yes,
Yeah.
exactly. After I went back to my doctor, and he said, your UCBU it's okay, everything is okay,
Mhm.
the sperm is okay, you have nothing.
So they have the tests. They did the tests, and everything come back normal.
Exact, yes.
Yeah.
And they say, okay, you have to go to a psychologist.
Okay, this is the problem. I have many patients who are supposed to have some psychological problems. Actually, the prostatic inflammation really disturbs psychology.
Yes, that's right.
Really, it is affecting. Sometimes people say me after the treatment, "Hey doctor, you saved our lives." I said, "What? What is life?" They say, "No, I would suicide." What? For this disease? Why? They say, "Yeah, it is really life disturbing. A chronic condition is really this making too much discomfort, and they can't live normal life." Some of them. Your situation was not very chronic, only 1 year. Our patients usually have this maybe 5 years, 10 years. They go tens of doctors. So you are a fresh, recent case.
Yes,
You are
yes,
a fresh
that's right.
case.
But it was not easy. I have to stop my job for 2 months because of the pain, and yes,
Stop your job for 2 months.
Yes, and misunderstanding of the doctor was very difficult because I was alone, and for the test of the sperm, I went to France because in Switzerland, I don't accept I do that.
Yeah. So how you decide to come us? How did you find the which made you think that this may help?
I have a friend in Russia.
Yeah.
We spoke about that, and he explained me everything.
Yeah.
At first, I wanted to go in Russia, but
yes,
for the moment,
you know, we do the Russian type.
Yes, I know.
So we learn it from Russians, and first my patients told about. In Turkey, there are a lot of guys who is going to Russia and have jobs there, have wives there, have life there. So they told me about it, and I don't know, but I believe with one patient. I said, okay, why not? Why not try? Nowadays, I am telling to many colleagues, many urology doctors about it. They don't believe. I don't know why. I am a little easy man. I believe everything. So they said, I believe, and I begin to perform, and it worked.
Yes.
So you plan to go Russia, but Russia is nowadays very closed.
Yes, exactly. It's difficult.
Yeah.
After I make some research on internet,
yes.
and I find. And my brother-in-law is from Turkey, so it's easy for me.
Yeah, We talked to them. Your sister is the wife of him. Yeah, they speak Turkish nicely too. So say hi to them.
Yes.
So you understand that I am doing the Russian type.
Yes.
So when you come, when we talk to you in the internet first, I said, okay, this is a typical patient, and I think you are an easy case because the disease is not very chronic, very long. And the first day when we do the massage, a lot of fluid came out.
Yes.
So this is something. Some fluid is hidden inside the prostate. This will have some effect, of course.
Yes.
So we drained it now. Okay, it's very early to understand the results, and it is. I always give the example. It's like pinching and squeezing a pimple.
Yes.
When you see a pimple, you know you have to squeeze it. The prostate is same. And when you squeeze it, fluid come out, you are happy. Oh, fluid came out. In the prostate, same. But if you leave it like this, it will come again.
Yes.
So you have to squeeze more. When you squeeze, you make yourself pain. It's painful. You squeeze, and at the end there is a little blood coming out. In prostate, no. But when we squeeze more and more, maybe at the last session, it's painful, and you have to stop somewhere.
Yes.
So, and when you look at the mirror, it is all red because of your squeezing, not because of the pimple. So we made a lot of irritation. We want to make this irritation. So new blood vessels will come there, blood will come there, and they will cure you, they will heal you. Very interesting. In your tests, the first day we take out too much fluid, nothing came out. This is usually the scenario is like this because the antibiotics are powerful. They heal anything. They heal the bacteria. Of course, in chronic cases, the situation becomes tricky because antibiotics kill good bacteria, bad bacteria, so it mixes. But in recent cases like you are treated well with the antibiotics, but the fluid inside didn't drain.
Yes.
It's an unluck. Not all the people has this unluck like you. There may be some other reasons that we don't understand. If it may be related to your previous life, previous sexual activities, many things, some trauma, many things may be present. Sometimes, for example, divers always have cold exposure. They are prone to have prostatitis. Fishermen, the people working outside with cold temperature, they are prone to get. Sometimes people walking at home with naked foot, barefoot, they are prone to have this infection. Sometimes you masturbate in your childhood, you don't want to ejaculate, you squeeze it, it explodes inside. This is a predisposing factor. Sometimes people pass kidney stone. These stones give harm to prostate. This is a reason. So many reasons.
And I think the stress too.
Also too much reaction in the prostate, it may happen. So there are many reasons. The Western world is very good at classification. They say a bacterial prostatitis, non-bacterial. Okay, your case was bacterial at the beginning. We know it came with infection. Then now it's abacterial. It's non-bacterial now.
Yes.
And there's no bacteria, but still there is a cavity formed inside the prostate, and now it's filled with fluid. The fluid cannot find the way out, so it's making pressure inside this cavity, and it's making discomfort in the prostate.
That's right.
So what we do, we drain this cavity. We emptied it. There was no bacteria, but still the treatment does not change. So Western world classifies prostatectomy, chronic pelvic pain disease, bacterial, abacterial, many things. But treatment, they don't. For bacterial, they give antibiotic. Some of them heal, but if there is destruction and fluid trapped in the prostate, it's not healing still. And for the bacterial, they have nothing to do. But draining the prostate with massage, it is helpful for 80% of the patients. I hope it is helpful for 100%, but still we have some gap that we couldn't find the treatment for 20% of the patients. Mm-hmm. This is in Russia like this. I learned from them. In Turkey is still the same. We are trying to improve. So tell me, what happened after the first massage? How did you feel? Did you feel some changes?
So at first I was very stressed because of the massage.
Yeah. It's painful, right?
Not really, to say the truth, but it's not, how to say that in English, we have a discomfort when we do that. It's
and before you were stressful too, you don't know what will happen, and you heard it's painful.
Exactly.
Then?
But painful, not really,
yeah.
But discomfort, yes.
Yes.
That's true. After I had a little pain because of the stress, and the muscle next to the prostate was very strained.
Yeah.
And yes, we have some, after the treatment, it's like, okay, a difference, yes.
Yeah, taking out this fluid, coming off of this fluid, doesn't give any is it giving any relief? Sometimes it gives relief to some people, sometimes it doesn't change too much. What was your opinion?
For the first time, yes, I look the difference, but for the after, I think because it's more and more, I have squeezing.
Yeah.
It's come back a little bit.
Yeah.
And I will see the next day.
So yes, the first day when we empty it, it's some kind of relieving the pain, and you are happy that's coming. But as the pimple, when we squeeze the next following days, the pain we make the pain. Mm-hmm. We make the redness in the. So now we are expecting your next weeks, you will feel the real comfort.
Yes.
And unfortunately, this treatment has to be repeated.
I know.
So we say you have to come back again if you need. Sometimes if your case is very simple, very recent, maybe you will never need it again. But sometimes you will need it after 1 month. Then we will repeat it for you were here for 5 days, and we did the massage for 4 days. And sometimes we do it for 3 days, sometimes 4, sometimes 5. So we ask the patients to come if needed 1 month later. Then maybe some of them will need to come one more time 3 months later. Maybe some of them will need to come 6 months later. I'm sorry. So this is a good sightseeing city. Istanbul, there's a risk of earthquake, but you have to be careful about the earthquakes. And you can do sightseeing, you can come here. But you may need to come again and again. At least more and one more time. But what I try to do, I'm trying to teach people how to do self-massage.
Exactly.
If they can perform it, maybe they will never need it again, never need to come back again. So we will be in touch in the follow-up. You tried the prostate massage. Could you find your prostate?
Yes. At first I was a little bit afraid because it's not something it's special.
Yeah.
I tried to find the first day only to find, and I find, yes.
Yes. How is it? So when you push, did you do it in the sitting down position like this on the toilet?
No, I was in my
bed?
room in the bed. Yes.
In the bed, you were laying down.
Exact.
And
I make to my right.
So your lateral position.
Exact.
So did you put the finger from behind or from front?
From behind.
Okay, from behind. When you put the finger in, your touch will be to back side of the rectum. So there is you don't have the prostate.
Like this.
You
can change the side.
Yeah. So you know it's in the anterior part of
Yes,
the rectal wall.
Exactly.
So could you find it?
Yes.
Yes, and you know it is inside the rectum. When you insert your finger, advance your finger, there is a empty space rectal wall. Then you hit to a chestnut size organ, and this is too big. This is Vasa Museum in Sweden. One of my patients will give it to me. So we will hit not this big, smaller, but hit something like this.
Exactly.
So some half of it buried inside. You can only feel this part. So you felt it.
Yes.
Then you try to push your finger to upper part. If you can't, take a deep breath, strain yourself, push your abdomen down, strain your abdomen down, and try to get to the upper part.
Exactly.
Then try to squeeze like this. I usually do it in a different way. My assistant Ali did the rest of the massages to you.
Yes.
We do it like we separate it to 6 parts, and 5 here, 5 here, 5, 5, 5. But it's not easy for you.
No,
So you can squeeze like this. Look, squeeze like this, and try to do it. We have to find some protocol. It is new for us. I am trying to, and your physique is good. Your body status is good. We can easily reach the prostate in your case. There are some people that we cannot reach the prostate completely. Actually, the fatty guys, it's very difficult to find the prostate, to reach the prostate. So they can't do themselves. So I want the people who can reach to squeeze like this. I recommend you not touch for 2 weeks, because now we squeeze. we made the irritation, we made the pain. Leave it some time, give it some time, and it will heal in 2 weeks.
Okay.
After 2 weeks, or maybe 1 month, you can wait. So try it, squeeze it, do it 1 day, give a 1 day break, do it 1 more, then wait.
Okay.
If fluid come, so we will be in touch. Fluid come or not problem. So you may need another antibiotic. I will prescribe you now some spare antibiotics.
Okay.
And you may use another box of antibiotics. So we will go on like this. We will follow you like this. And so you are doing it in this lateral position, laying down and put the finger from behind.
Yes.
You can also try it sitting on the toilet. After doing a poop, the big thing, feces, the anal sphincter is very relaxed.
Okay.
So you can push the finger, advance the finger at that time, and when you strain, it comes down. You can try that way too.
Okay, I will try like
And so we are trying to improve. This is very new to us. We are trying to find some method. We can use an instrument, but now I have no experience with that. I don't want to recommend this because some people can give harm to themselves.
Yes.
I don't want to give any recommendations like that. But maybe in the future we will find some method, because I want the patients to come here once and finish. Then teach them how to do it themselves, then follow up. So we are at the beginning of this with you. We will see. Previously I was calling you back, so 1 month later I will call you back.
Okay.
If you can come, then we will do it again. And in the future, extending the intervals, a couple of times we can call you. This is our protocol. What's your thoughts about this? What's your last sentences as a summary?
No, I recommend it because all the people here are professional, and the kindness is nice.
Thank you. Do you believe it will work?
I hope I will see it the next day, but I think
Yes.
yes. And I have the example with my friends in Russia with the same protocol.
Yes.
And to finish, my friends say yes. Here it's like a simple thing, so.
And it's not taking too much time. Every day you come here for one hour, then you can go sightseeing.
Yes.
So it's like an Istanbul trip 5 days Istanbul trips, go sightseeing, just come to us for 1 hour and make a trip in Istanbul. If it doesn't work, you made a visit in Istanbul, you can say it like this.
Exactly.
Thank you very much. Thank you very much for this video too. It's really informative. I hope people will get some help from this. And my main aim is to teach people how to do it themselves. I am very open to recommendations and experiences. I want people to share their experiences with self-massage. We have to understand and learn this self-massage, and I need recommendations. Say hi to everyone.